It's a mouthful, but hey, you know what? We want to reach everybody that we can out there and talk about topics like this, especially when you get a grade A. And that's the kind of cool part of it. Bringing in to the studio, Drew Dostal, president of Corewell Health, Ludington and Gerber, here in the studio. We visit with him from time to time, and he's back in here. Hi, Drew. How you doing this morning?
Doing great. How are you this morning?
I'm doing okay. Thanks for coming back in here. And Meleah Mariani is in the studio with us. Hi. Welcome back to the studio as well.
Good morning, Chris. Thank you.
Yeah, thanks for being here this morning. We're going to be talking about two different elements this morning, including the Leapfrog A grade for patient safety. And I think whenever you get grade A, all right, you get an A, and as well, when you put in something that the word is safety there, add it with patient, I think that says a lot about Corwell Health right here in our community. And Drew, we'll start with you for the next few minutes, if you don't mind, and take us through what we're talking about with Leapfrog and earning this grade and what it means for Corwell Health. Do you mind doing that with us?
Not at all. Thanks, Chris. So Leapfrog is a national, actually they're a little bit international, but we really think of them as a national agency that does exactly that. They'll put together quality scores and safety scores and see how, put them into a scoring system that everyone understands, A, B, C, D, and F. And luckily, there were only, I think, 17 Fs in the whole nationwide, which is good. And none of them were in Michigan. So we're all very happy about that. So Ludington has been on this journey as long as anyone else. And we've gone between A and a B, but we've been in the A now for 2.5 years running, which was really a goal and really amazing during COVID. To maintain that safety goal when a lot of people were, having respiratory virus that spread as easily as it did, oh my word, that is scored. So for us to come out on top with these kind of numbers, really something to brag about and something to feel good about in your community, that you have such a safe and high quality hospital right here as a resource in your local community.
And it's good to hear. It's the 5th consecutive time. And Janelle, do your kids come home with 5 A's in a row? Does it happen?
No, not too often.
All right. So and with that happening, you probably get a little bit disappointed if that if that doesn't happen.
Oh yeah.
From a standpoint with the hospital, Drew, bouncing back and forth between the letters, that just puts sort of that bar a little bit higher. And it's like, how can we exceed our expectations next time? Because this grading is not just once a year, it's twice a year. Is that right?
Yeah, it sure is. Twice a year they come out with these grades, and they move the bar as well. So quality scores aren't static. They have the ones we had even 3 years ago have changed. On a national level, when we look at Medicare and Medicaid, who kind of starts the whole ball rolling in the quality realm as far as measurement goes. So to have that bar constantly changing and us meeting that goal is really the story I like to tell, because it gets harder. And, a wise person once told me that healthcare is like running around a track as fast as you can go, and every time you make a lap, you got to go faster. So we're trying to keep up with the things we need to do, and we're doing it. So I feel very, very proud for the team.
Well, that's good to hear that.
So is it like the customers are taking like surveys, or is it like a group of people come in and grade you, or how does that all work?
Part of it is on surveys, but most of it relies on data that comes from things like readmission, how we do with certain conditions like cardiac conditions, treating those patients, how we do with folks with diabetes care. So really it's kind of a solid data point. It's really quantitative, not qualitative, in that it's not somebody saying that we're great. It's the data proving that we're great.
It's good to have that. Meleah, in regards to this, just for a moment before we move on to the apprenticeship program, which that's going to be a bulk of the conversation that we have with you this morning. But from being the chief nursing officer at Corwell Health, what does a grade like this mean? How do you spread that message to your staff members, to your team members, and what are those conversations like, if you don't mind?
Yeah, thanks, Chris. We're just really proud of our not only the award of the, an A, but really knowing where it comes from, and that's our team. And so we do, in this day and age, you have to have a variety of communication methods. In the old days, we just used to have a staff meeting and we'd post the really important stuff that we wanted to share and communicate on the bathroom wall. But nowadays, we use a variety of different methods to communicate. And so most of our units, the nursing units, have like a week, they call it the weekly digest. And so we do a lot of recognition and praise there. We do rounding, and we also then have the traditional formats where we have meetings and such. And we always start every meeting with either a safety story or a moment of excellence or gratitude. So we do a lot of sharing verbally as well, but just really proud of the team. And then we do some staff appreciation events, team member appreciation. I think you might have been part of one the other day where we were handing out donuts and cider. And it just gives Drew and I and other leaders an opportunity to just thank people in person and share with them the great things that are happening in our hospital.
Good deal. Is there any, what do you think that the reaction of the nurses and whatnot is like when they find out that the hospital received an A?
I think actually nurses put a pretty high bar on so I think they would expect nothing less.
Right,
so I think they're a little bit maybe humble about it in terms of, well, of course we should get an A, because I think they set their high bar always. I hope that they feel proud because it is a great recognition, and it is hard to achieve. There are quite a few metrics in there, and like Drew said, during the pandemic, it was tough, just really tough in general, being a nurse and taking care of patients and doing all the right things. So I hope they're proud. I think they probably are. I think they would also, if you were to talk to them, say, well, we would expect nothing less than that of ourselves.
Oh, that's awesome.
They're very high-performing team of excellence.
Yep, 200% there.
There you go. If you're just joining us, we're talking with Drew Dostal, president of Corwell Health, Ludington and Gerber, and as well Meleah Mariani this morning, talking and chief nursing officer at Corwell Health. Let's kind of pivot here, unless there's is there another tidbit of information, Drew, that you want to share with the audience this morning about the Leapfrog A? Is there anything else that we want them to know? Because I think from a consumer standpoint of the hospital, right? I go to my doctors there. Is that I think it's important that we know how well the hospital is performing, and sharing that data and sharing that information is crucially important.
Yeah, that's the whole story. Is we want people to know that, and that's the reason why we partake in things like Leapfrog, so that we can test ourselves against other people and prove that we're doing the right things, and then it actually gives us things to work for. But then at the end, when we do earn those high marks, we want our we want our community to take our marks and put them on their refrigerator. We got a good grade, just like your kids. So we want you to be proud of that as a community as well, because it's the support of the community that keeps our people working and happy and loving what they do, because they're hard jobs. I've spent a lot of time with our ER folks lately who they're just really, it's still a very stressful job, and they come in every day and they do it with smiles on their face and always trying to do the right thing. So I'm really thankful that we have community folks who will recognize that and give them a pat on the back in the front line and saying, hey, I heard about your Leapfrog A. Congratulations. That's awesome.
Yeah,
right.
I definitely give like a ton of support towards those that are nurses or surgeons or doctors, anything like that. I could never personally do that job. What the people see in like the ER and everything that they deal with, I just couldn't. Like it's crazy.
And it is tough, isn't it?
Yeah.
It is. There's also so much joy that comes from the work as well, so it can be very physically and emotionally demanding at the same time. It's that one person that looks at you and says thank you, and you can see the difference that you've made in their life or maybe for their family. We have happy moments too, where somebody, might be a sad time where somebody gets a diagnosis of cancer or something, and then there's that happy time when they're ringing the bell and they're done with their therapy and feeling good, and we deliver babies, and so.
Yep. I still remember my delivery nurse, and my daughter was born. Well, she's 12 now, so I still remember that nurse just made like a huge difference in my life. Like she was wonderful.
Yeah,
so
great. That's great to hear. Yeah, so I think they balance things out, and if you do have a particularly tough day, I think we're all getting better about just take a moment, collect your thoughts, maybe talk with a coworker or someone, and because you're right, it's right back out. You got to get right back out there and take care of business. So.
If you're just joining us this morning, Drew Dostal and Meleah Mariani with us this morning. Let's talk about, as we pivot here in the conversation, about the RN Apprentice Program. That's a cooperation between the West Shore Community College and Corwell Health. And Meleah, take us through that, because you've got two nurses right now that are benefiting from this program, and probably a lot more down the stream, right?
Yes, so thanks, Chris. I'm really excited about this program. This is something very innovative and new. We have not had apprentice roles in healthcare traditionally. And when we have had them, they haven't been like licensed professionals. We might have some job codes that have approved apprenticeships that have maybe a certificate, require certain training, but for a licensed, nurses are licensed by the state of Michigan. So it's a first for the licensed nurse. So our program, actually there's 3 partners. We started this journey about a year and a half ago. Shelley Booz at the college, she's the nursing director for the program, the nursing program at West Shore Community College. She emailed me and said, "You want to come to a session to learn about apprenticeships?" I'm like, apprenticeships? Like I think of apprentice in the trades, right? Mm-hmm. So long story short, we had some informational sessions and just tried to learn more about how we go about doing it and what it would look like. There's different language that the Department of Labor uses, and so there are Department of Labor forms that you have to fill out. And so we also worked very closely with Michigan Works West Central, our partners there. So it's really the 3 entities. We provide the on-the-job training, the school provides the academic program, and Michigan Works West Central provides access to all kinds of funding and things that could be barriers to someone completing a degree. And so the 3 of us all teamed up, navigated our way through a Department of Labor paperwork with help from some state Department of Labor folks, as well as the national office. Our document actually went to Washington, D.C., to the National Apprentice Office there for approval. Those things took some time, but this last summer we were able to get the final approval on that, and we are just in the process of hiring 2 of them. We just completed interviews this week, so of course you always get more wonderful candidates than you have for the position. So we have some tough decisions to make. Actually, today we'll be deciding about who will fill those 2 positions.
All right, excited to hear about that. And it's, we hear 2 areas too. There is a need for nurses. A few years ago, though, especially before COVID, there was where it was difficult to to get off the waiting list. There was a tremendous amount of lists, wait there. But with this particular program, it's also a paid apprenticeship too, and I would assume that's even more important to those that are out there that are struggling with student loans and everything else that comes along this day and age too.
Correct. Yeah, and I think that was another piece that we had to try to figure out. Well, how do we pay somebody who isn't yet licensed? So these are students, the 2 that we will select. They have to be enrolled at West Shore's program. That's currently. In the future, we might be able to expand that, but our current document is in partnership with West Shore and Michigan Works West Central. And so they're not yet licensed. They are in school, and so what the program will do, what an apprenticeship does, is while the student is learning about things, so in nursing, traditionally you start with like fundamentals of nursing 1, fundamentals of nursing 2, pharmacology. Then you start doing your OB rotations, med-surg rotations, things like that. So our apprenticeship aligns with the program. So while they're learning fundamentals in the classroom and they're doing all of their academic requirements, we then have them partnered with a very senior mentor at the hospital, showing them the ropes of like, here's what you learn in school, here's the reality of what it looks like working in an acute care hospital. And that's kind of been missing before, is they haven't had that on the job piece to learn like, okay, well, I graduated, I have my degree, I now get out into the real world, and things are very different. Yeah. So this will help them transition from the academic to the practical.
And what are some of like the qualifications to be in these positions?
So right now, and we've had a lot of interest in this program, and I hate to turn anyone away, but right now it is with you. They do have to be accepted into West Shore Community College's nursing program. Okay. I could spend all day talking about why that is, but it's part of the Department of Labor requirements is that you have to have that academic partner. So they have to have they have to be in good standing with the program at West Shore, and they have to be 18 years of age or older, which probably most of them are when they're accepted in the program. And then they have to have a certification in basic life support. So it's like our basic CPR.
Okay.
And then we'll, through the on-the-job training, get them trained up on other certifications while they're working with us.
Yeah.
And Drew, this is part of dealing with that nursing shortage. And I think from just talking with Meleah and listening to Meleah just a few moments, first of all, the nursing shortage that is out there, but also your on-the-job training. I was an adjunct at Grand Valley for a while there, and when you're talking to the students in many cases, and the real world comes into play, there is such a disconnect in some of those instances. This will help build that and kind of mold that area, right?
Yeah. Pardon me, I'm getting over a cold. That's exactly right. It's to help, as Meleah alluded to, the real world and actually what you learn in school. There's a little disconnect there. You have to have those basics of the school to understand the science behind what we do. But in the real world, there's different ways of getting things done that nurses learn really good techniques. And if you can have a mentor who's been around a few years and learn those techniques just by applying them and trying and, seeing what works and what doesn't, you can pick up some great tips and actually shorten the learning curve and make you a much better person in the field quicker. And that's our goal, is to make sure we can get people a little more secure in what they're doing, and then at the same time have them independent quicker.
All right, looking forward to it. Meleah, before we wrap up this morning, you have hopefully quite a few candidates that have taken advantage of this program. Hiring two today. If you had to describe, and obviously we're not asking you to hire them on the radio, but the two candidates that you would be bringing on board today, what do they possess? What's the characteristics that you're looking for when it comes to your nurses at Corwell Health?
Thanks, Chris. Yeah, I can't comment too much. HR will get me. But I can tell you what we were telling all of the applicants as they were coming in to help them prepare and think about, is this something they really want to do? And part of it has to do with the Department of Labor requires 2,000 hours as a minimum in the apprenticeship. So obviously, getting these apprentice candidates early in the program, so they've just started at West Shore this fall, and optimizing times like Christmas break, the summertime, any holiday break from school. We would try to have those folks working as much full-time as possible. So some availability and flexibility with their schedule is really important because that is a requirement. We have to get those hours in. We also are very honest in telling the applicants that we're really looking to grow our own pipeline here locally. So we do want to talk to people who are interested in staying in this area and serving our community. We were very honest when we went and introduced it to the class, and I said, if your goal is to get a degree and just get out of Dodge, probably not the right match for what we're looking for. We're looking for creating some longevity, so not only recruitment, but some retention and opportunity to grow within our system, because sometimes people think, oh, a small hospital, what do you have for me? We have a lot, and we're part of the large system of Corewell Health. So there is definitely opportunity for upward movement and career, advancement. So we're looking for people that can be flexible and get the hours in and have a heart to serve in our community.
Yeah, I definitely agree. I mean, Corwell Health has everything there now. I mean, I remember when it was Memorial and it was just a hospital. Now it's your doctor's offices, your surgeons, everything's there. It's so convenient. I love Corwell Health, so.
Oh, there's a commercial, right, Drew. But Drew, as we'll give you the last message here this morning. But as the president of Corewell, Ludington, and Gerber, these programs, the apprenticeship program, the Grade A, I would assume that message to the community is that since it was Memorial and then and its name changes, Spectrum and Corwell Health, you want to continue to improve. You want to be able to share that message with the community. There's always going to be bumps in the road. It has happened, but you want to make sure that there's growth and achievement happening too.
Absolutely, Chris. And, we try to make the moves in the right directions. We can't do everything. Obviously, we're limited by, same as everybody else, space and money and time, right? Mm-hmm. All the great limiters. But we want to move forward. We know that healthcare is very, very personal to people. So when it doesn't go exactly right, it feels personal. And we know that. We realize that. We're trying to be perfect. We know that that's unattainable as well. We ask for grace when we don't, but we certainly will try to make it better. And let us know. We really need to know what's going on and what you're seeing and what direction maybe we should be moving. And we like to ask those questions in the community as well. And that helps us. It helps guides our growth and our strategy as we move forward. We talk about it a lot. So we appreciate those comments, and it helps us move in the right direction for you.
All right, sounds good. Meleah, this apprentice program, the time frame that the next generation of candidates could start, is it just during the active school year? Is that correct?
Yeah, we're hoping these guys coming in now will be coming in just a little bit late. We would have liked to have had everything ready by August of this past year. So we'll be coming around to the next, the fall 2024 cohort. Once they all get accepted, we'll be going and introducing the program to them probably in April or May.
All right, sounds good. Drew and Meleah, thanks for taking some time with us this morning. We appreciate you.
Thanks for having us.
Absolutely. 8:48 now here on 102.7 WMOM and Hot Country